Olive oil, obviously, use those. The things you have to be careful with something like olive oil is olive oil starts to smoke at a very low temperature, so you typically don't want to really cook with olive oil unless you're cooking at a low heat. Because if you oxidize olive oil, you turn it into a bad fat. You want to keep it as a healthy fat. Coconut oil is great for high temperatures. I use coconut oil in everything. It's a medium chain triglyceride. It's fantastic for not putting on fat on the body. It's great for the brain. So use coconut oil a lot. Yeah.
I would like to point out that this man is over a century, half a century old.
Thank you. A century, huh? Half century, okay. That's it. I was going to say, actually, tell them a century, they'll all like run into the office. Yeah, that was a shameless plug right there. So. Now, when I say bad meats, meat's not bad, okay? But here's the problem. How many people use commercially raised meat? Okay, you all raise your hand. I know you do. What's that? If you grocery store meat. Unless it's grass-fed. Here's the thing. Hi. Grass-fed is the kind you want. Why? Because cows are designed to eat grass. They're not designed to eat grain. When they eat grain, their omega-3 to omega-6 ratio is totally skewed in the wrong direction. Omega-3 is not inflammatory. It's actually anti-inflammatory. Omega-6 is highly inflammatory, and most Americans are in a 20-to-1 ratio of inflammatory fats to non-inflammatory fats. So you want to make sure you're getting plenty of 3s and not very low 6s. Okay? Very low 6s. So bad meats. Commercially raised meat's bad for you. I forgot it again. We forgot the Happy Meal. I have a Happy Meal in my office. No, it's all right. I have a Happy Meal in my office that just celebrated his 8th year birthday. I want you to know that. Yeah. We have proof. We have proof. And it looks great, by the way. You guys have seen it, right? It looks great. You've seen it. I know you have. Yeah, it just had a birthday, September 11th, of all days. Processed carbohydrates, one of the first things one of the worst things, I should say, we ever invented. You know, back in the mid-'80s, what were they saying? You know, fats are making us fat, get off the fats. So the mid-'80s, they said, start eating what? Your healthy whole grains. And you know what happened? We all got fatter, and diabetes skyrocketed. So now diabetes is way, way up. We have about 1/3 of our population is either diabetic or pre-diabetic. All because we're eating these healthy whole grains or processed refined carbohydrates, which create a total sugar environment in our bodies. Any other toxins from drugs, smoking, cleaning products, all that kind of stuff, all toxic to the body, obviously. What do you think of those graphics, huh? That's pretty good? Not bad. Inflammation is a major cause of disease in the body. You guys have all heard of it now. I mean, it's starting to get out more and more. It's not inflammation like when you twist your ankle. It's inflammation of the entire body, your whole systemic inflammation. And what they're saying is inflammation seems to underline not just senescence, but the chronic illnesses that often come along with diabetes, atherosclerosis, Alzheimer's, heart attack, cognitive function decline, premature aging, and even cancer to the extent. When inflammation becomes chronic rather than transitory, the body turns on itself. So how many people do we see with autoimmune disorders, where their body's literally attacking itself? It's coming from the inflammation. Not only that, those processed refined carbs in the wheat that we eat also creates leaky gut. And when you have leaky gut, now you have toxins from your actual intestinal tract, whether it be the bacteria's toxins, the rotting food, whatever it is, it's starting to come through the walls of your intestine into your bloodstream to be distributed throughout your body. So that's another reason why not to eat highly processed refined carbohydrates. Now, to the good stuff. How are we going to fight cancer in your body? Because as I said, the best thing we can do is prevent it. But if you've got it, these things will work too. And this is what we recommend, the cancer killers. Number 1, who's ever heard of angiogenesis? Maybe some of our patients have. All right, angiogenesis. Angio means blood vessels. Okay, so when somebody has angina, okay, that's blood vessels. Genesis, of course, means new. All right, your body's creating new blood vessels. Why is it doing this, though? Well, it turns out that cancer cells are highly reactive cells, right? They're very active. They grow quickly, especially some of the more aggressive ones. So what does that require? Capillaries. So what cancer cells can do is actually send out something called angiogenic factors. Angiogenic factors, they secrete out in the direction of the capillary, which runs right past it, and it actually buds off and forms new capillaries. So the cancer cell is actually trying to save itself and make itself grow by creating new capillary beds. Okay, so that's got to be very new to you guys, right? Cancer cells require a lot of blood, a lot of nutrients, because they're very fast moving, so they actually create more capillaries because of something called angiogenic factor. So, what do we want to do? Well, if we don't stop this process, what cancer cells will then do is they will then to start mutating and metastasizing all through the body. So as they start to release the cells, they go into the bloodstream, and then the cancer is able to freely move around and go to different places. You know, many times I hear patients say that the doctor found a mass and they want to biopsy it. Well, I'll tell you, that's one of the scariest things I think you can do. You know why? Because your body's done a really good job of walling it off. Your body's done a really good job of encapsulating it. How many times do we hear people say they punctured it to take out a cell and then it metastasized somewhere else? Because now the cancer cell's not contained anymore. The body has been containing it all this time. And now you went in and ruptured that sac, and now it metastasizes. I never recommend biopsies. I don't like them, unless it's maybe a benign type of cancer. So we don't recommend them to our patients. But you can see right here, once it hits that bloodstream, it's moving all over the place. So angiogenesis, on a scale of more to less angiogenesis, let's start looking at some of the drugs. These are some of the drugs they make for cancer. Okay? Some of the different names of them. Interesting thing is this. Here's some of the common drugs they made for cancer. Now watch this. Here's common foods that you eat, or should be eating, I should say. So we see cruciferous vegetables, red grapes, garlic, soy, and by the way, that's more fermented soy. That's not soy, silk soy, or the tofu we get over here. Berries, parsley, artichoke, soy extract, green tea, lavender, turmeric, tea. I mean, our bodies are designed to take the foods that we put into it, and it does the same thing. So if we could take foods that we can get from the grocery store or supplements, I would much rather do that. Who would rather do that to their bodies, to take those kinds of things to stop this angiogenic capillary growth? Wouldn't that be a much better solution? Yeah, you think so. That would be a much better solution to me and any of our patients that come in our office with cancer than taking any of the drugs. And there's no side effects. It's safe. It's easy to do. And it's stuff that you can get in your own grocery store anytime. So here's a list of some of them. If you want to jot some of them down. Or if anybody wants some of this information, give your email to our office and we'll see if I can get you the slides. Put them in like Dropbox or something because they're pretty big slides. But here's some of the ones that are the top angiogenic foods. All right, and like I said, you could take a picture of that or I could email it to you or something. But they're all up there. All right, last call for pictures and then we're moving on. Look at all the cameras out. What's that? Oh no! We'll get with my office manager in the back. She'll get you set up. All right, we're ready? All right. One thing I always recommend to our patients is this. You eat to live. How many people here live to eat? Right? Right? You live to eat. Now, I'm Italian. I know what it's like. I love cannolis. I love my pasta. But I got to get away from that and realize that I'm eating to live, not living to eat. So here's the thing. Live food, I want you to remember this. Live food equals life. So you want to eat a lot of vegetables, be a lot of plant-based diets. Dead food equals death. All right? So keep that in mind. The further we get away from the way God created the food or made it, the more toxic and nutritionally deficient it is. You know, cabbage, all the cruciferous vegetables, the Brussels sprouts, broccoli, all great foods. But not when you cook it to death and put cheese and onion rings on top of it and make a casserole out of it. You know, berries are really good, but when you make a berry pie out of it, it kind of depletes the purpose of it. So if you eat the food the way it's designed or as close to the way God made it, you're a whole lot better off. All right. This is the food pyramid we recommend. A little different than the food pyramid you're used to seeing, but this is a healthier food pyramid, and this is the one you need to really, really focus in on. Notice the bottom's got a lot of vegetables in it. Lots of vegetables. Notice the bottom right-hand side has a lot of fats there. All right? So this is kind of like a, who here has heard of paleo? A lot of people are starting to hear about paleo. Paleo is a great way to diet. It's the way our ancestors ate between 5, 10, 15,000 years ago. A lot of healthy, high-quality meats, as you see. Healthy, eggs, meats raised where they're grass-fed. The oils, there's your avocado oils, your olive oil, and so on. As we move up, we get into some of the vegetables, fruits. The fruits there are the less glycemic, index spiking fruits. Okay, you more of your citrus fruits there and so on. And then, of course, at the very top, in the very smallest amount, is your grains and desserts and things like that. So that's what we recommend. We don't say never have those, but the most people are just loading up the bottom with it so that you're predominantly eating different types of grains. It's your whole diet is grains. And that's where you start to really create a lot of molds and funguses and a lot of cancer cells developing in your body. And we're going to get into that in just a moment. So this is the food pyramid we recommend. Now, here's the thing, too. Dr. Seyfried's work confirms that sugar is the primary fuel for cancer, and that by restricting sugar and providing an alternate fuel, namely fat, a lot of you shaking your heads already, I love it, and providing an alternative fuel, namely fat, you can dramatically reduce the rate of the growth of cancer. How many knew that? A few, good, good. You guys are starting to get this information out to you now. Here's the thing. We know that the primary fuel, and pretty much the only fuel for cancer, is sugar. I remember telling that to one of my patients who came in with cancer, female cancer, like cervical cancer. And I told her, I said, you've got to get off all sugars. We've got to change your diet. We're going to get you off all sugars first. And at first, she kind of fought me on it because it's obviously hard to get someone off of sugars. It's very difficult because their body's addicted to it at this point. But here's the reality. If we didn't, all you're doing is feeding the cancer. And she came in one day, she goes, Dr. Nick, you know what? You were really right. I went in for a test. My doctor wanted to see if there was cancer anymore in my system, see if it spread anywhere else. And he gave me a solution, an IV solution with the markers to mark the cancer, and it was in a sugar solution. Because what they find is the cancer cells will eat up the sugar and it lights them up. And then they're marked. So they're going to seek out the sugar. So the reality is that sugar is the primary fuel. Cancer cells run off of the fermentation process of sugars. So you want to get rid of cancer in your body or prevent it or kill it, what do? Starve it. You starve cancer cells. And you know what? You'll get ripped in the process. You will totally get ripped. And that's a side effect. It's a good side effect though, right? Cancer cells have anywhere between 10 to 70 times more insulin receptors than normal cells. So what does that mean? They're designed for sugar. That's what they're looking for. So you want to starve cancer. You want to destroy it. You want to get rid of it. You never want to get it. Stop creating the environment for it. The ketogenic diet does just that. How many people have heard of the ketogenic diet? All right. The ketogenic diet is basically similar to paleo, but we're going to change some numbers a little bit. Okay? Ketogenic diet. Cancer cells need, once again, glucose to thrive, lowering glucose levels in your body, in your blood, through carb and protein restriction, because protein also can get converted for the energy for the cancer. Literally starves the cancer cells into oblivion. And once again, this doctor is one of the foremost authorities on the planet when it comes to this. He puts all his patients on the ketogenic diet. Eliminating all but non-starchy vegetables, carbohydrates, and replacing them with healthy fats and high-quality protein. Eating this way will help you convert from a carb-burning to a fat-burning machine. So the great thing is this. You then start to change and transform your own body to where your insulin receptors get, because a lot of people eat so much starch, their body gets totally insulin desensitized, Insulin resistance we hear about a lot now.